Hello everyone, Dr. Cary Yurkiw here for True North Practice Management. Thank you for joining us today as we're going to go over what True North Practice Management is and how we help health professionals. I started True North in 2020 after 25 years of practice, and I continue to practice today, but also run this consulting business where we help health professionals with things that were not taught in school. So these things could be the business side of practice where there's challenges with maybe employees or cash flow, decision making, investment in real estate, or just your future as far as a health professional goes, and keeping that good work-life balance. So we really want to see you succeed, and we're here to help you with the things that you weren't taught in school. So why True North? Well, we know that there's challenges being a health professional. I personally know that with 27 years of experience now. And we know that there's obstacles that come up, challenges that you're not prepared for. And sometimes it's good to have someone to bounce that off of. Friends are great for that, or colleagues, but also somebody who's a little bit more objective and someone who can give you some advice that's been there and done that. That's where we really our strong suit lies. And so help to overcome your challenges, make better decisions, and then success and practice in life. Well, how do we do this? Well, we specialize in certain areas, and um, areas like we help health professionals to be healthy, and that's body, mind, and spirit. So we want to see our clients healthy, number one, because we believe if you're not healthy, it's hard to be able to serve patients and your community. Um, and this can involve physical exercise routines, relationship building in and out of the office, and work-life balance. So just your time management and making sure that you have a good work-life balance so you're happy and healthy. And then time management. We know your time is valuable, and so we want to see you delegate tasks to people around you or hire people that can do things that you don't need to do. So you want to delegate some of the tasks you have and only hold on to the ones that you're specialized in. And we want you to have a plan. So as you grow, you can hire people, you can continue to train, you can continue to delegate. So we really want to have a plan for you to continue your growth and continue your success long term. For social media, we want to help you to get the word out. So we know your service is special and unique, and you're different than other professionals in your field. So we want to make sure that you can get the word out, and you do that in a fun and educational way. And so we're here to help you with your social media. And we want that social media following to grow so that your practice grows, you get the word out and serve more people in your community, and it creates more opportunities for you, whether it's opportunities locally or nationally or internationally. We want to make sure that the social media posts that you make, whatever channel you're using, continues to expand your opportunities. We want to automate this process, so we want to make sure that your staff can help you with this and delegate it to your staff. We want to advise you on what to post, how to respond to people that are asking questions, and how to follow up so you can get bookings or interviews, depending on what your goals are. Some other interests that we specialize in is writing books. And so I've written 4 books now myself, and one is Success in Private Practice, and then another one that I just wrote is The 100-Day Diet. And we will help you to plan for that, to structure a book, to upload the book, and to get sales. So many health professionals want to write books. They want to share what they know, and it's a fun process, but there is a lot to know to write a book as well. And then the financial management of practice. So we want to see good cash flows for you. I know at the beginning you just need to get some traction and get going, but as you get good cash flows, we want to pay down debt, make sure that you're not spending money unwisely, invest in real estate, whether it's for your practice or personally. Other assets, and that could be equities or things like cryptocurrencies, and then have a long-term plan so that you can continue to enjoy practice. You can do some other things you love to do, whether it's travel, whether it's other hobbies that you have, um, so that you can continue to do things you love to do long term. And then another area that we specialize in is moving your services online. So using telehealth or doing more consulting. This could be with your patients, helping other health professionals like I do in a consulting capacity if you have experience and knowledge. And I think a lot of health professionals don't think of that, and their knowledge and experience goes to waste because they don't really pass that on to people around them unless they're in a group or running a practice. And other areas of interest that I have are weight loss and running. So uh, often people will ask me about how I lost weight and how I wrote the book and what I'm working on now. And then running, I love running half marathons. I try to do 2 a year. That's my goal. And I like traveling for that. So I share that journey with people on social media. And if you want to set a goal for yourself on running a half marathon and start training, and that's on your bucket list, I can certainly help you with that. So join our future webinars. We're on Eventbrite and we're on Facebook. So follow our page on Facebook. You can follow our page on Eventbrite. I'll put links below in the post. Most of these webinars are free, but some are paid. And if we've got a topic that we go more in depth on and want to share more knowledge and be more interactive with you, often we'll charge a fee for that type of webinar. And then we do one-on-one consultations. And the first one's 30 minutes. We want to get to know you better, what your challenges are as a health professional. And then we want to help you plan to overcome them. And we want to kind of work with you on that, challenge you, and to hold you accountable to taking those steps you need to take to overcome these obstacles. And we usually do a 13-week process. So once we set up what the goals are, how we're going to overcome those goals, those challenges, we'll do a 13-week plan, which will involve weekly calls that'll be about half an hour in length. Some of the calls are shorter, 15 minutes, and some are a little bit longer, so depending on what you need. And then we'll do email and text in between calls to give you the support you need. And then after the 13-week period, we'll review. We'll review if you've accomplished your goals, if you have more goals that you want to set, or are you good on your own for a while? So we kind of work in a package of 13 weeks, and the cost is usually running around the $100 mark per week. That's $100 per week. But again, the price changes depending on how much time we need to spend with you on the calls and how many texts or emails in between calls. At True North, you can follow us on YouTube at True North Practice Management. Our podcast on Android and Apple is Health Professional Biz Success. And we are on social media at True North PM on Instagram and Twitter, Facebook at True North Practice Management, LinkedIn the same, and our website is truenorthpracticemanagement.com. I want to thank you for joining me today. If you have any questions, don't hesitate to ask those questions in the comment section below. You can certainly DM us or even call us at the phone number here on the slide. The US number is the 917 number, the Canadian number is the 250 number. And I look forward to talking to you soon.